Dr. Gary Bellman, board certified urologist. If you're on testosterone, do you need to worry about your estrogen levels, specifically estradiol? Maybe not. So let's discuss. At any one time, we have the yin and the yang. We have the testosterone and estrogen or estradiol, even before starting testosterone. And when we add testosterone to the body, some of the testosterone aromatizes or changes into estradiol. And for years, we had this idea that we had to keep testosterone higher and estradiol levels lower because we were so concerned about mostly gynecomastia, man boobs. And over time, we would give men estrogen blockers, Arimidex or anastrozole. I'm on testosterone. I used to take Arimidex. And then over time, people had some side effects for it. Our idea of estradiol has changed. And now we give very little Arimidex and very little anastrozole. And I'm not talking about anabolic steroids. I'm talking about testosterone replacement, 200, 250 milligrams and below. And the majority of my patients don't need anti-estrogens. And their estradiols go up to 80 or 90 or even 100, and they don't need any estrogen blockers. And so this is a paradigm shift in how we think about estradiol. And people online in clinics are like, oh, we have to lower the estradiol or else something bad is going to happen. No. In medicine, when we write a prescription for another medication, we have to have an indication. We have to have a reason. And so, do I have some patients who I prescribe anti-estrogens? Yes, but the majority not. And they don't get gynecomastia. And I'm not talking about anabolic steroids. If you're on gear, if you're on multiple doses of testosterone, you are at risk for gynecomastia. And if you don't take an estrogen blocker, you might need some surgery because the lump in the breast can be a problem. So the take-home message is it's a paradigm shift. Our idea of estradiol, it's not bad. Actually, men need estradiol. And the great majority of men who are on a half cc twice a week or a cc a week, which is a typical dose, most of them don't need an anti-estrogen. Some people aromatize more and some people aromatize less. But we don't need to treat it because another pill has side effects. We want to avoid more medicine unless it's absolutely necessary.